I'm just reading this Time magazine article.
Just too interested this morning.
Everybody's been talking about this. Yeah, our health news today. Our Ask the Doctor segment. Breastfeeding is the topic. It's getting a lot of buzz recently because of this Time magazine article with the new cover of Time showing a Southern California mother breastfeeding her 3-year-old son. The issue very important to a lot of moms, and that's why we've asked Dr. Dave to address this today. I take it you've read the article.
Breastfeeding protects infants against infections, illness, and provides nutrients for growth. It's also linked with a decreased risk of breast cancer and postpartum depression in mothers. Researchers say that many mothers hope to breastfeed but need more support.
Yeah, it's hard because, you know, we know that it's a good thing for women to do. You said most women stop by 6 months, and then there's some mothers that go for a really long time. So do we know what is a good amount of time for breastfeeding?
Yeah, I'll talk about that in just a minute. There are 5 things that mothers should know about breastfeeding, and the first is getting healthcare provider support. The hospital period is a critical period for mothers to learn how to breastfeed. You want to talk to your doctor or nurse before you deliver what your plans are. And although it's a natural process, it's not always easy, and meeting with a lactation specialist can help your efforts. The second is community support. There are 4 organizations in Fresno to improve the relatively low rates of breastfeeding in Fresno. Babies First has a website and a call center to link mothers with lactation specialists in the community. First 5 is a public agency that provides a breastfeeding friendly express trailer, a comfortable space for mothers to breastfeed at various community events.
And even take it to the fair.
That's right.
Because I complained one year. I said there's nowhere to breastfeed at the fair, so they brought one in.
Exactly. Fresno County, through the Department of Public Health, is supporting an initiative to train local birthing hospitals to become baby-friendly. This is a global designation that indicates the hospital is using the best practices to support mothers in breastfeeding. And finally, the La Leche group is a peer support group which links mothers to other mothers in the community to breastfeed and work. The third is workplace support. Employers and mothers may not be aware that healthcare reform requires many employers to provide a reasonable break time and a private space for mothers to breastfeed or express milk during the workday for the first year of a baby's life. Number 4, and the Time article question is, how long should one breastfeed? According to the American Academy of Pediatrics, mothers should exclusively breastfeed if they have no health problems for at least the first 6 months and should continue for at least a year because of benefits to mother and baby. In the U.S., only 13% of babies are exclusively breastfed at 6 months. There are multiple factors that determine how long a mother will choose to continue breastfeeding.
Okay.
And finally, are there mothers who should or should not breastfeed? Yes, there are, because of various medical conditions or non-medical reasons. This includes having prior breast surgery, HIV, TB, certain chronic illnesses, being on certain medications, and using drugs or alcohol. And even with help, there are mothers who cannot, or it's not possible to breastfeed.
Okay, I know we could talk about this all day, but we're out of time, Dr. Dave.
So do it as long as you can, is what
yeah,
saying,
however long you're
Hang
comfortable.
in there.
Right. Email your topics for Dr. Dave to us at newsdesk@cbs47.tv, and we'll be right back.